Hi, and welcome to the Get Local podcast. We are so happy that as our listeners, you are joining us yet once again to learn about some of the new local hidden gems right here in the upstate. Today, I am so fortunate to be able to welcome to the studio Sandra Kerley from Kerley's Medical Services. Sandra, welcome to the Get Local podcast.
Thank you.
I am so happy that you're able to join us. For our listeners, we're here at the 864 Sound, which is a studio in Greenville, South Carolina. Brandon Higginbotham is the owner, and you guys definitely have to check him out. I'm going to give you a little bit more about him before we close today. But Sandra, so welcome.
Thank you. I'm so excited to be here.
Well, Sandra, I don't know if our listeners know about you. So you are with Kerley Medical Services. Tell me, who is Kerley Medical Services?
Medicare services.
Medicare Services.
That's fine. So Kerley's Medicare Services, I am a senior health benefit advisor. I am licensed and certified to assist those that not only seniors, but those who are disabled, who have been disabled for 2 years or more, and they're on Medicare, and help assist them with their options outside of original Medicare.
Wow. Now, Medicare, when you say that word, that's kind of intimidating to a lot of folks, right?
You know what? It is. And in all honesty, I didn't know how intimidating it was until I really did get into it.
Oh, my goodness. Now, tell me a little bit. When did you guys start your business?
So I started in June of last year.
June of last year. So you're a newbie business owner.
I am a newbie business owner. Absolutely.
So was this your first venture with Medicare, or did you already know a little bit about Medicare before you got started?
So I knew about Medicare before I got started. I worked with one of the private insurance companies, training Medicare agents for the last about 4 years. For what's called AEP, which is annual enrollment period from October to December, when they get to choose their new plans for next year. And so I did that, and my mom, who lives with me, she kept telling me I needed to go get licensed, get further into it, and start helping people instead of just training the agents. I needed to, help people myself, because I became so passionate about it and I loved it so much. So I decided to take the leap last summer. And it's funny because she talked me into going through all the specialized training and licensing and everything. And I called my accountant and said, hey, so I just want to, figure out how this is going to work, because I'm going to start working with Medicare plans outside of original Medicare. And he said, oh, you're going to start a business. Come see me next week. And I was like, oh, wait a minute, I'm going to do a business? Okay. And yeah, so it started with, me working a full-time job, learning about Medicare, falling in love, and my mom just always pushing me, as she always has, to be the best me possible.
Well, that is a great story. And so many entrepreneurs, they have this vision of what they want to do, and then it's the family members who really do spur them on. So kudos to your mom for helping you find something you were passionate about and saying, go do this,
Yes.
I mean,
yes.
That's so important. So tell me a little bit about what y'all do. What exactly do you do with Medicare?
Okay, so there's original Medicare, which is what you receive through the government or CMS, Centers for Medicare and Medicaid Services. What I do is I work with private companies and the private companies offer what's called Medicare supplements, which will specifically cover the gaps, because original Medicare pays 80% of your doctors, your hospitals, things like that, and you pay 20% copay.
Okay.
So a Medicare supplement and they have 10, 15, there's a bunch of different supplements that will help cover that 20% gap and help pay for the gap that Medicare doesn't. Some of them can have deductibles, high deductibles, low deductibles, that can range. But that's all it's going to cover. Then you have Medicare Advantage plans that are going to cover, you're going to have a copay for the doctor instead of, that 20%. You can have extras such as over-the-counter, vision, dental, things like that. And you can have, and here's another thing that I definitely want to put out there. So it is required that you have credible drug coverage, but original Medicare, that's not an option.
Really?
Original Medicare does not. It covers your A, which is hospitals, and your B, which is doctors. It doesn't cover drugs, but yet you have to have a prescription drug plan. Credible coverage can either be through, if you're still working, or you have it through retirement, or some military, or you have to buy drug coverage through a private insurance.
Oh my goodness. Now, if someone, let's back up for a moment. So if someone is going to get Medicare, they're going through a government agency to sign up, correct?
Correct.
So now that government agency, are they telling the individual all the things that you're just telling me?
So unfortunately not.
Because that's what I was thinking.
Yes. So unfortunately not. And to be honest, even some of the brokers out there will not explain.
So do they just find out when they go to purchase medicine and it's not covered, or?
So that, unfortunately, I'm not exactly sure how that works, only because when my mom and mother-in-law got on Medicare, I knew Medicare, so I was able to help that with them. But as far as the education goes, that's my number one priority. When I meet someone who is getting ready to be on Medicare or someone who is already on Medicare, education is my number one thing. Well,
I think that's fantastic. So how are you getting in front of these folks who have Medicare?
So I do go to vendor fairs. My daughter got me linked up with Greenville, North Carolina American Legion, and I do plan on reaching out to the one in Spartanburg. I have a Facebook, Kerley's Medicare Services, working on a website. And I give my business card out like it's candy. Not gonna lie. I also talk to, kids, I say kids, but kids my age, 40s, 50s, about their parents, because that's another thing is Medicare is, as you and I have discussed off camera, Medicare is an animal all of its own. It's not like an insurance that you've ever had, right? So because it's so overwhelming, when possible, I highly recommend to have an adult child there or your spouse or sibling to help understand everything that comes with Medicare.
Right.
And not just Medicare, but the outside options that I offer to go in tandem with their Medicare.
Yeah. And we did talk about this a little bit off camera, but I remember when my parents first went on Medicare, my father called me and he said, I'm a very educated man, but I'm reading this and I have no clue. Do I need to get these supplemental plans? I don't want to be, at the time he called it a donut hole. I don't know if you get that, but
I do.
He was talking about all of these things. And I said, sure, Dad, I'll come down and take a look at it. So when I opened up the pamphlet, he's getting ready to choose what plan he's going on. I'm like, I have no idea. I was thinking, I'm an educated person, but I don't understand it either. And so his first year, we chose a plan and it ended up not working for him. And he was paying all of this extra money. He didn't get a supplement plan. So, I just think there needs to be some way that is communicated to, and I love what you're doing. Bring the siblings in or the children in so that they can help to give that information to the parents. Because a lot of times the parents don't understand it.
Yeah. So not only do I ask, and some people, not everybody has someone. I just let them know, if you do, please feel free to bring them along. Also, I feel like that's a safety net because so many of our senior citizens are taken advantage of in today's world. I want you to feel safe. You know what I'm saying? Bring family. You want your neighbor there because that's the most trust. Bring your neighbor. Ask me questions and I will actually tell them, if I ever tell you I'm changing you from this plan to this plan and I don't tell you why, you need to ask me why. Because even with my mom, I've changed. She hasn't been on the same plan in 3 years. In 3 years of her being on Medicare, she hasn't been on the same plan yet. Plans change every year. So I explained to her the same way I would anybody else. This is why I'm changing your plan. Because if you just say, yeah, I'm changing your plan, here you go. Well, you can be on a plan that is going to suit your needs 100%. But if you're not educated on that plan, it's worthless.
Well, don't you think too that as you age, your medical needs may change? Because I saw that with my father in the beginning; they were still healthy,
Right.
But then my father developed COPD, and his medical needs changed. Then my mother had diabetics; she became a diabetic, and she had a pacemaker. So all of a sudden, their plan needed to change because their medical needs changed. So are you going out every year and sitting down with them to say, this is what you were on last year. Let's talk about what's happening medically this year.
Yes,
I love that.
That's a great question, because a lot of I have spoken to quite a few senior citizens who have been on the same plan for 10 years. And that's great if that still is going to fit their needs 100%. So I tell everyone from the beginning, listen, my mom she's been on for 3 years. She has not been on the same plan 3 years in a row yet. Sometimes I've even changed her company. My mother-in-law has been on the same company 2 years in a row, but 2 different plans.
Wow.
So because yes, every single year I do want to sit down, and even if your medical hasn't changed, the plans have. Right. Just as you have corporate America saying, hey, we're going to make this item cheaper than somebody else, Burger King versus McDonald's, right? The private insurance companies are doing the same thing. So that time we need to sit down. Have you been on a medication that now you're coming off of, and now a better plan is going to, suit your needs to a different level?
That's wonderful. Now, you said you were going to fairs, for instance, or, community events, and you're probably setting up a booth and trying to talk to folks as they walk by. Do you call them on the telephone? Because I know, like my parents, they receive so many telephone calls that are targeted towards senior citizens, and they're so leery when people call them on the phone.
Love that question. I refuse. And here's why. First of all, I'm not going to call you let me rephrase that. If they've come to the fair and they've come to my booth and they sign a paper stating that I can call them, then yes, I will call them.
That's
I'm going to
great,
call them,
Sandra,
to tell you I want to set up an in-person discussion. So I prefer all of my interactions to be in person, especially at first, because if you're looking for just a person on the other end of the line, there's 1,800 numbers out there, right? There's one Sandra Kerley. And I'm very specific in how I do things. And that's whenever possible. If you're like, I just want to talk to you on the phone, I have no issues with that. My preference is I'd like to be able to sit down, meet you. You see that I'm a real person.
Right.
Okay. I carry my laptop. I carry my printer. So if we sit down and I'm able to put you in a plan, I'm going to print out the statement of benefits. Anything that we discuss, I'm going to highlight. Okay. Then anything I've highlighted, I'm going to paperclip. Okay. So if I highlighted page 1, 2, and 3, there wasn't, I don't want to say it's not important, but it wasn't anything we discussed. It wasn't relevant. I'll paperclip that with 1. But then on page 4, I highlighted, that's going to get a whole new paperclip.
Gotcha.
So that everything is organized. I make notes on what I printed out so that I want you to feel like that conversation that we had in person is still on paper for you, but I'm also a phone call away.
Right.
I'm also a phone call away. I have my clients who I tell my clients, all potential clients are just family members I haven't met.
Oh, that's awesome.
I do the same thing with them that I do with my mother and my mother-in-law. They both live with us. And I just, I'm one phone call away. If you have a problem with a bill, I have a few that don't feel comfortable even calling over the phone and ordering their over-the-counter benefits. So I do that for them.
Oh, that's wonderful, Sandra.
You know what I'm saying? You don't understand a bill, call me.
Now, you said something earlier that I want to make sure that our listeners do hear. So, for you, you're not just working for one company. So, you don't have this one supplement that you're trying to sell. You're able to really just sit down with them, figure out what their needs are, and then you have a plethora of different agencies out there, correct?
Correct. So I do work with multiple, currently I have 5 private companies I work for, but let me make this clarification. Just because if there is a plan out there for you in your area that is best for you, and I don't work for that company, I'm still going to tell you to go with that plan. I will help you call that company that I don't work with. Why? It does multiple things. Well, Sandra, you don't get paid. You know what? I do, because you are going to go tell your friends, she wasn't even, she doesn't represent this company, but yet she advised it was the best to go with. This was the plan I needed. She helped me call them. And you know what? Reach out to me again next year. When it's time to look at next year's plan, we'll see if that's still an option. But at the end of the day, my job is about putting you in the plan that you need to suit your needs.
See, I think that's so important for our senior citizens because, right now with COVID, money is tight. And I think when you're on, as you get older, there's no question you're going to spend more money on medical cost. There's just no way around it. And if you're on the wrong plan, you're going to spend more money. And, I'm hearing more and more senior citizens. My husband's a pastor, and a lot of times the senior citizens will tell us we had to go back and get a job to help supplement because we don't have enough money to pay. And it's mostly what they say is we can't pay our medical bills and our medicine. And so they're having to go back and get another job versus if maybe they were on the right plan, maybe they wouldn't have to have that extra income.
That's 100% correct. And so that brings me into the next thing of my services are free. Right. So, I get paid from the company. Okay. Again, if I'm not contracted with the company that's going to put that you're, need to be in a plan with, that's fine because it's about what's going to suit you best. And then maybe if that I see, okay, well, I need to get contracted with that, company. That's fine. But at the end of the day, it's going to be what's best for you.
Right.
And everybody, that's going to be something different for everyone, but that is first and foremost. And so the last vendor I went to was in Greenville, North Carolina. My daughter lives there with my son-in-law. And I went to the fair at the American Legion and American Legion Post 39. And I spoke to over 20 people who, if you look at it from a sales point of view, I got nowhere. But if you look at it from a real true point of view, I helped so many because I spoke to retired ECU professors who didn't, and this is something else, who did not know that they were in what's called a group plan. Now, someone like me, if I hadn't done the research and I had put them into a new plan, they could have lost their retirements.
Oh, wow.
They could have lost their 401k. They could have lost so much.
So their sales representative in helping them with their Medicare is extremely important because if they're a newbie and didn't have the knowledge like what you were talking about, they could have been in some trouble.
100%. If they, and I asked them directly, are you on group Medicare? And they said, no, we are not. So they gave me the knowledge they had. I went and did the research and I went back to their table and I said, actually, you are. And that's another thing. Their own human resources department that puts them in group Medicare did not educate them on that.
Oh, my.
So there's so much. The biggest thing I would say about Medicare is there's a lack of education. And that is my top priority, is to educate you first. Okay, find out if I can help you. If not, I still, hey, you reach out to me for any questions and I'll be happy to help.
So, do you go to like churches and talk to senior citizens? Maybe they call them all kind of different things in a church, but they have different names that they name themselves. But do you go to like maybe small groups and talk to them? Do you go out into the community, senior citizen community centers?
So there are a lot of laws surrounding what I can and can't do. I will be working at going to senior centers on the weekends. I work full time during the week, and then of course I have juggling time, family, all that. But I am starting some plans to go to some senior centers. I do have flyers up. I put my business cards around. When it comes to churches, to me, that is something that's very sacred. And so I don't ever want to go to a church from a business point of view, as it's a double-edged sword, because I know I could do so much help, but at the same time, to go with that intent, I just feel is wrong.
Yeah. Well, you may find a lot of churches often, and I said earlier, like with my husband being a pastor, a lot of times the senior citizens, they're looking for guest speakers to come in. And so they want someone to come in and talk about a topic, not just necessarily a religious or spiritual topic, but something that can educate their group, because, we want to care for each other in
absolutely.
a community. And I think the service you're providing, I wish I'd known you when my parents were going through that, because definitely we could have used your services for sure. So, and I just don't think people know you're out there. I mean, I didn't know you did that until we met and spoke.
Right.
I didn't even know that service was available.
And I can't tell you how many times I have heard that. And I actually have the same story. My father was on Medicare pre-65 because he was disabled, and he was a vet. He was a veteran, and when he was alive, I hadn't gotten into Medicare. I didn't know anything about it. But I also, side note, I also was not as involved in his medical as I wish I had been. So I am much more so with my mom and my mother-in-law. And so to be more involved in their medical and understand Medicare forget the business side, from a child's parent, 100%. That's so important. Be involved in your parents' care. And insurance. And it's hard because, so many things over generations, there's certain things you don't discuss, right? Finances and other things. And that's fine. You don't have to discuss finances to discuss Medicare. You really don't. And Medicare and medical insurance is just really, I think it's a family discussion. I really do.
So when is the time of year where people are starting to look for assistance? Is it October? You mentioned a time frame earlier. So when should people start calling you?
Yes. So feel free to call me anytime during the year, because I will give you a free assessment. Go over, look and see what you have, see if there's more out there. As far as actually changing, so October 15th to December 7th, you can change what your plan is for the very next year.
Okay. So they really probably, if you're making that change, you can't see everybody October through December. So it's probably good to start calling you maybe August, September, and start letting you evaluate what plan they're currently on.
Yes. I say call me anytime for evaluation.
Okay.
As far as evaluation, like I said, call me anytime. But I can't even see next year's plan until October. Okay. So starting, and I can do applications as early as October 15th and the very last day, December 7th. And I would just say it now. I'm already busy December 7th. American Legion Post 39 in North Carolina already has me booked that day.
So get you before December.
Get me before December 7th. But yeah, so definitely that's called annual enrollment period. It doesn't matter if you're on original Medicare, Medicare Advantage, Medicare Supplement. It doesn't matter what you're on. We can look at what you want to look at for the next year. And then turning 65, up to 3 months before and up to 3 months after. You can get onto an Advantage plan, and then supplements are a little bit different. But coming close to 65, I say call me before you get there, and let's look
Okay.
at what's available.
Now, Sandra, we mentioned, and I know we're kind of getting near the end of our time here, but you had mentioned that you go to people's homes. You do have a home office, but you want to kind of get in their environment where they've got their paperwork and you can kind of sit with them and they're relaxed. And I know senior citizens a lot of times are just, they're very apprehensive about going into an office or going to someone else's home. So I think that's fantastic. Tell me the areas that you cover. So if our listeners are, because we do York County, upstate, and there could be people in other states listening. So where do you cover?
So great question. I cover the entire state of South Carolina, the entire state of North Carolina, and the entire state of Virginia. And I do travel. I come to you regardless of where you are. Just make the plans. And I just want to say it again. If you have family, whether it be a child, a parent, sibling, I highly recommend a neighbor, a best friend. I highly recommend having someone there. I feel like it gives you a safety net. But I also feel like that's a second set of ears to listen and hear. It's so overwhelming. Some people, I will sit there and we'll take pauses. I'll say, okay, because I'm okay with reading facial, and I'll be like, okay, you're getting overwhelmed. What overwhelms you? Let's stop here. Do you need a break? Whatever.
Yeah, and you don't get that over the telephone. So definitely sitting in front of someone, I could see that helps you to slow down or back up or repeat something.
Absolutely. And I feel like that takes the pressure off of it, because I need you to see me and see that I'm not here to sell. I'm here to educate, make sure you are where you need to be at. And if not, then assist you in getting there.
Yeah. Well, you're a brand new business owner. So I'm going to ask you two questions that typically, someone who's been in it a little bit longer can always answer. But, what would you say has been your greatest joy of starting your business so far?
I'd have to say the greatest joy is the look on their faces when I've been able to help them. That really, I do sometimes get more excited than they do. I'm not gonna lie. But yeah, just the feeling of what I'm able to do to help. Just that, and honestly, a side note to that is, my logo is a peacock. And my dad, whenever he did something, my dad was such a jokester. He was such an easygoing guy. And actually he got all the men in my family to do it, including my husband. They would do a peacock dance and put their arms out whenever, something funny and prideful. And so that's, being able to, put a piece of my father in there.
Yeah.
And then my mother-in-law, not knowing that, she gave me a set of coffee mugs that go on top of each other that built a peacock.
Oh,
and so
awesome.
That stands for my dad and my in-laws, and puts it together. And so I loved being able to do that as well.
Well, I like for our listeners to realize that the people that we have on our show are real people. So,
yes.
You're not just a business, but you're a real person. So, with starting your business, I'm sure you've had some challenges. What is a challenge that you've faced in this short time of owning your own company?
Finances, for sure. So I work a full-time job. My husband works a full-time job. Having his support means the world to me, not just financially, but emotionally. I do travel, so there's travel as well, which, everybody in my family supports, but definitely finances and time. It seems there's never enough of both.
Never enough of both. That's for sure. Well, how can our listeners reach you?
Okay. So I have a Facebook, Kerley's Medicare Services. You can also call me at 252-207-5047. And you can also reach me by email, 79kerley@gmail.com. You can reach out to me any way. with a quick question. If you'd like to meet up, I'd love to schedule a time with you. Like I said, there's just so much that, I could sit here for 2 hours and talk about Medicare, to be honest.
Well, I am so glad you came in today. I want to ask you a quick question. I always ask a funny question at the end. So here's my question. If you could be a fly on the wall and you could be that fly on a wall anywhere in the world, where would you be?
Oh, that's a good question. Fly on the wall anywhere I could be. That is a really good question. Let's see. I'd probably be in the Bahamas somewhere, even as a fly.
In the Bahamas, enjoying your time there.
That's
There you
right.
go.
I'd be in the Bahamas,
In
just
the Bahamas, enjoying the weather. Well, Sandra, thank you so much for coming on our show today. The
Thank
podcast.
you so much,
I
Joanne.
appreciate it. For all of our listeners, guys, hey, I want you guys to reach out to Sandra. I know I have had, as a matter of fact, I'm going to book her to come see my mother. I think it's a wonderful service that she's providing, and I hope that you guys will take advantage of it. I want to thank Brandon Higginbotham with 864 Sound. He is located on Sweetbriar Road in Greenville, South Carolina. And oh my gosh, he has it's just a long list of services. This man is amazing. You guys need to reach out to him. If you want any music, recording, he does video, commercials, podcast. He is just amazing at what he does. He loves small businesses. I hope that you guys will take advantage of reaching out to him and his great services that he provides. For my listeners, we could only do this because of you. So thank you for joining us. Please share this podcast. We have it audio and video. So please share it with your friends. Tune in each week to a brand new local little hidden gem who our business owners are real and relevant, and they want you to shop them. So let's shop small. Thanks for joining the Get Local podcast. Until next time, bye.
Thank you.